Wait, she has to. Oh, good. She started.
Okay.
Sandra, you
What
doubt
can
me.
I do without you, Sandra? I don't see Gigi. Okay, she will join. Okay. Hello, everybody. Welcome to the Women Learning Group of the Spanish and Portuguese Synagogue, Montreal. My name is Gladys Perez Mualem, coordinator of the Women's Learning Group that started 14 years ago by our previous Rabbi Shahar Orenstein, following Ladies Bat Mitzvah. Celebrated on July 5, 2009. It is a great honor for us today to have our friend speaker, dermatologist Dr. Alfred Balbul. For the third time, our topic today is healthy nails. We all care for our health, for our nails, for our skin, for our hair, and Dr. Balbul is supplying us with all the information for that. Just a few words about Dr. Balbul. Dr. Balbul is graduated from McGill University with honor degree in chemistry. Following his enrollment in medical school, he specialized in dermatology in Canada and US, and was appointed a clinical professor of medicine. However, he spent the majority of his time in private practice. His interests include medical and surgical dermatology, as well as laser and aesthetic medicine. For me, he is my dermatologist doctor, and he is a great doctor. Thank you, Dr. Balbul. Our next Wednesday speaker will be Ita Yudin, Vice President of CIJA, the Center for Israel and Jewish Affairs. Everybody is invited, men and women. Same Zoom details as today. We'll continue every Wednesday at 10 o'clock until December 6th. Dr. Alfred Balbul, bevakasha, bechavot.
Thank you very much. Let me just get my computer working 1 second.
Okay,
Now you should.
take your
We
time.
see it. We
You
see
see
it.
the. Oh, oops, I'm at the
Perfect.
wrong end.
Yeah, you're
Now
on the
you got
other
it.
end. You're done with us. That's it.
Excellent. So basically today's discussion, one thing I'm going to say is I'm going to speak slowly because I don't have much to say. It's not a very long story about nails. My first lecture, I spoke at about twice the speed of light because I was trying to cover too much material. This time, we're going to speak more slowly, and hopefully we get a meaningful understanding of how nails work. So basically, we are blessed with having nails, and we want to be able to, they're supposed to be lasting us a whole lifetime, and we want to be able to make simple measures to how to have the nice nails and how to maintain it. So what we're going to talk about is the importance of nails, more of a physical, but also very much psychological, social importance of nails, the structure of nails. We will talk about the anatomy of the nails to some degree, how nails are different in different age groups, different people of different origins, and obviously men and women take care of their nails differently. So there are changes between men and women. And finally, with aging, what happens? There's not much to say about diet with nails, but we'll make a couple of mentions of things that sometimes help strengthen the nails, how to take care of your nails. And people always want to know what is the best thing that I can do for any food I can do to have better nails, better hair. This is really the slide that I talk about the importance of nails. I think people, we are now at a stage in our evolution where nails are less important from a functional point of view. Nobody is grabbing and digging roots with their nails. But I think there's a tremendous amount of importance psychologically to having beautiful nails. So when people look at their fingers, at even their toes, they're very, very much influenced by how well taken care of, or how good the nails look compared to the ideal. And so this is shows this picture from the internet as an ideal hand nails, and even then you can see that the nails are longer than what we like. If we wanted to really keep them functional and working, we want shorter nails than that. But people take a lot of pride in their nails. They do all kinds of nail cosmetics. There's a whole industry of nail care products and nail care salons. And so it's really underlies the importance of how much importance people of both genders put to their nails. One story that's aside is people get that the whole discussion today will come back and forth from having fungus in your nails. But I remember having a patient with AIDS before there was any medications for it, and he was a very, very sick young man. And the only thing he cared about was his nails. He cared about his nail fungus. He didn't care about his lung disease, his changes in his whole system, but the nails seemed to sort of really stick out in his mind as to how will he take care of his nails. So even in situations where you think that there are way more important things than nails, nails still are very important from the point of view of the psychology and the well-being of the person. So this is part of the story that I was telling you about the whole industry that takes care of nails. This is a UV light that sort of accelerates the hardening of the acrylic monomer when people have acrylic nails. So it sort of shows you how much energy is being spent on this. And there's actually a dermatologist in the United States who thinks that people are going to get skin cancer in their hands from all this ultraviolet light that women are being, or men, I guess, also are being exposed to. So if you're using this a lot, when you go to the nail salon, please put sunscreen even in the middle of the winter on the back of your hands, so that you don't damage the back of your hands and get spots on the one hand, or get even changes in your DNA and potentially skin cancer. So when you see this, it's not a totally innocuous thing, and still people are doing it. So please be careful with this. But it shows you how much cost and energy people are doing to have beautiful nails. So this is a normal nail. I picked this again from the internet, and then we go through the anatomy of the nail from the outside. And basically, this is the nail plate, which is what we think of as the plate. And the nail is bounded by, it's called the lateral nail fold, which is the piece of meat that connects it. And you'll see there's a fold in, and this is sort of the structure of the nail that holds it. There's an extra thick piece of skin at the end of the nail, underneath the nail, that is called the onychodermal band, that prevents gunk from getting underneath the nail. So these are part of the natural protective features of the nail. So the onychodermal band is here, and why am I spending so much time on it is I don't want you to spend energy taking instruments to try to clean underneath the end of the nail. Okay, so because this you'll disrupt this hard area on this side. You don't see it very well here because somebody cleaned it, but there's supposed to be a cuticle that is coming from the flesh to the nail plate. This cuticle is a big target for all these nail places. They try to clean the cuticle, and very often that leads to infections. That infection is called paronychia. So please don't play with your cuticles, or don't let them push very hard to create a dicey nail, because at that time there's a space here as the flesh is folding forward of stuff that can get in here and cause another source of infection. So these are the two vulnerable areas of the nails. The sides obviously too, but it's the same process. There should be like a cuticle that's holding this together. And you have to realize this is amazing stuff in the sense that the nail is continuously growing, yet this band of protection is there continuously. So please don't try not to overly clean here or push back the cuticles, because this tends to lead to risk of infections or damaging the nail. The last thing I'm going to say here is this little white area is called the lunula. Lunula in Latin means little moon. And the little moon is basically, that's where the root of the root of the nail is found. And the root of the nail, we'll see in the next anatomy picture, basically goes along the whole white area here, goes onto the sides to about halfway back to where the joint is. So the root of the nail is really sitting, hugging the bone, very, very deep down, quite far to the sides and quite close to the joint. And this process here is what causes the nail to grow, or what is the root of the nail. So we're repeating things again, but with an anatomy picture. This is the cuticle, the proximal nail fold, the plate of the nail, the edge of the nail. I like the simpler terms. But the important thing that I want you to tell you about is how far the root or the matrix of the nail goes. It goes pretty far down and deep, very close to the joint. This is the joint, and this is the bone of the last tip of the finger. Now, it is very much, the nail is very much a product of the bone of the nail. Okay, so the bone of the last, the distal digit. So the thing that happens here is that as the nail is growing sideways, you're going to see the nail gets its shape from the bone underneath it. So the fun thing that I like you to look at is hopefully we'll all see babies one day. And when we look at babies, you see that their nails all look messed up. They're pointing in, they're very cute. They're pointing in different directions. And they're sort of, each one has its own cute shape. And that's because they don't have a bone. There's no bone in the distal digit, in the last part of the finger. And that comes around the age of 6, and that's when around the age of 3 or 4, the nails start looking like adult nails. So it's fun to watch, to see this as how intimate or how important the bone is underneath. People tend to see just the nail and they don't see anything else. Okay, so the root or the matrix of the nail goes way far down, and there's this space here. This is the normal skin. There's this fold here where the cuticle is. Don't play with the cuticle. Try not to play with it, because you now have the space that really doesn't have any blood supply, doesn't have any protection, and so you can get an infection at this level here. The same thing here, the edge of the nail, there's a thick part of hard skin here, and this is protecting the underside of the nail. So these are the areas of potential vulnerability of the nail, and that's where infections take place, and the nails get damaged. So these are things that I'm showing you things that we look at, and this is something that is quite common. I'm going to show it at least twice, and that is a dark streak in the nail. Now, a dark streak in the nail, we see this relatively frequently, and we worry about it that it is, or it may become a melanoma, like a skin cancer at the root of the nail. So the process that's taking place is taking place underneath here, and underneath the flesh of the proximal part of the nail, or the soft part here, and it's way under. So if we want to sample it, we have to lift up the nail and take a piece of the nail root from somewhere underneath here to see where the brown color starts. Now, what we worry about is that, you're probably all looking at your fingers now, or some of you saying, oh my God, I have nail polish, I can't see it. But next time you have your nail polish taken off, have a look at it and make sure that you don't have any dark streaks under the nail. The vast majority are nothing. They're nothing scary. But once in a while, we get one, and if it is expanding, if it's something that that looks like it's getting darker and getting more wider across, then it's a sign that it is growing. Something that I like to teach the young doctors is nail is like the rings of a tree, okay, in the sense that the nail is being produced somewhere here. I hope you can see the arrow. The nail is being produced here today, and it grows at about 1 millimeter a week. Okay, so we're going now, and so this time now is here, and if you're measuring this as at about 15 or 20 millimeters from the tip here, this is 15 or 20 weeks later. So what am I telling you is that you can really see the continuity of time. So if you look at something and it looks lighter here and darker at the bottom, it means that this process is growing. Or if it's wider here than at the top, then in the last 3 or 4 months, it's been getting bigger. If it's a very straight, even color, you know that the process is very stable. It's not growing. And this is pretty stable. It doesn't seem to be getting larger. But the fun thing about nails is that you can really see the last 4 months in the color of this, but very often you can see the last 4 months in the health of the person as well. So if somebody's very sick or got toxic medications or whatever, then you're going to see a band across here called the Bose line, where they have an area where the nail didn't grow well. So you can tell, oh, okay, you had a severe fever 2 months ago, and then you can tell from the history of the nail just by looking at where this took place. So this is fun that you can actually see. You can actually project and see time, not just look at it as a static thing. So this is called the melanonychia, and it's something that if you have it, it's certainly worthwhile taking a picture of it and just following to see if it's getting wider. I doubt any of you will have it. This is different. This we've all had, right? This is, we stubbed our nail. Okay, so we it's a very different color than the last time because the color doesn't go all the way to the top. And if you see here, basically this is this poor lady got her thumb stuck in the car door probably, or I doubt she was using a hammer, but it fell on her. But usually it's from a car door or a hammer falling on you. And we got bleeding at the root of the nail. Now, this is very painful. And very often what we do is we actually go in and surgically puncture this. We take, when I was a young doctor in the emergency room, we used to take a paper clip with a lighter, really heat the tip of the paper clip with a lighter till it's red hot and push in. It literally melts like butter, and eventually you pop through, and then all this blood comes out. I think now they're probably doing it in a more sophisticated way, but that was a very effective and very satisfying thing in the sense that it relieves the pressure and the pain very fast. So this is a subargual hematoma, like a bruise underneath the nail. And now remember, it didn't go all the way straight. Like this is just an area that's dark. And if we look at it with really good light, you'll see that it's not black. It's shades of purple or red. Now this is where the whole discussion is going to end up. People always ask me these questions when I talk about nails, and that is, what about nail fungus? This is every single person that comes and sees me, that if they have abnormal nails, they think they have nail fungus. And so what we see here is that the nail, if we go to the anatomy of the nail looks nice. The plate is okay. You even see a little bit of a lunula. The person here is a good kid. He's not playing with their cuticles, so the nail plate is okay. But you see that the size of the nail have a yellow discoloration that's wider at the tip, and as we get closer, they're somewhat thinner. And two, there is extra thickening of the skin of the keratin underneath the nail. So this is classical nail fungus. In the sense that it grew in, came in from underneath the tip of the nail, and basically the fungus likes to eat skin. Okay, that's what this particular type of fungus, its main food is skin. Not many bacteria or fungi or viruses or animals eat skin. Okay, like they really digest skin. They evolved for that specifically, and they are now able to penetrate and under the nail and sort of live there in a very happy, warm, moist environment, and then they're very happy there. Another type of fungus that you're seeing here is basically the nail is growing straight. There's not much of a problem here, but the tip of the nail is now lifting up. And now there may be fungus here too, but the fungus here would be because it has an opportunity to grow here. There's a space, there's extra keratin, extra skin elements that the fungus can eat, and it has a roof, and it has food, it has moisture from underneath, it's warm and protected, and so the fungus, even if there is no fungus there today, eventually we'll get a fungus developing in these areas, and the nail is lifted here because it's been damaged in the past. So not all, this is something that we'll talk about, hopefully if we have the time, about whether the fungus is really primary, meaning that there's so much fungus in the foot that the fungus just invades the nail also, or there's fungus that develops in the nail from trauma to the nail, from damage to the nail. And this is my biggest, I don't sell much, but I'm going to try to sell shoes for you to have comfortable shoes that have lots of space for your toes and nails, so that you don't damage your nails, and by having damaged nails, fungus gets in as after the fact, secondarily. So now we're going to switch sides a little bit and talk about things that look like fungus. Now, if I showed you that last picture and I show you this one, we do the comparison, they look very similar. But this is not fungus, this is psoriasis. Now, psoriasis is a common condition, and it is something that causes damage to every part of the skin, sometimes the joints, and even other parts of the body. There's inflammation in other parts of the body too. But basically, different parts of the nails get damaged at the same time. So you see what's called pits. You get to see lifting of the nail with extra skin underneath. So that very much looks like fungus. And then you even see, changes in the nail underneath the nails. It's called like the color changes from being the normal white color to sort of a pink salmon color, or like an oil patch. So there's specific changes that we see in psoriasis, and everybody that comes in with this thinks, oh boy, I have psoriasis, I have fungus, and they don't think of psoriasis. Now, how do we tell? It takes a lot of experience to tell one versus the other, but very often people that have nail psoriasis rather than fungus, they have more on the fingers rather than the feet. The fungus of the finger of the nails tends to be more on the feet than the hands. So this is one clue. The other thing is basically it's multiple things happening at the same time, and the best clue basically is, and I make an effort to do this on all the patients. I don't just look at the spot that they show me. I try and look everywhere else on the skin. So if somebody has this, I'd be very sure that to look at their elbows, other areas where psoriasis may be, and make the connection rather than just look at this and say, yes, this is psoriasis, and give the wrong treatment. Again, so this is, if you look at this, we're going back to the fungus again, and you're seeing here there's a white streak that goes all the way back. The thing that I want you to go back to is my very first thing that I talked about, the anatomy of the nail. You look here and you see that the nail has extra curvature, like it's more curved sideways. You can't see my hands. So it's like has an increased curvature, almost like a pincer, like something grabbing. And that's usually because this person has been wearing shoes that are tight, and literally they squeeze the bones in. And so now the nail is, again, following the shape of the bones, and that became overly curved. And by doing that, what happens is that the center of the nail is now lifting up, and fungus gets in. So again, this is fungus, but it's caused by poorly fitting shoes over many, many years. So this is really the thing that I'm telling you. Very often you have to say, okay, this is fungus. Can I, even if I kill the fungus, can I fix it? And very often the trauma to the nail has been done many years ago, and you can't bring it back to normal. Again, we jump back and then sort of show you pictures back and forth. This is, again, psoriasis, not not fungus. And again, you see these little ridges or pits in the nails, a little bit of the yellow discoloration of the nail. The nail is fragile and sort of lifted up, and it's lifted in a very unpredictable way. Sometimes you see even psoriasis a little bit on the skin, just proximal to the nail. So looking at this very fast, when to look at this, oh, you know what, this is fungus, let's treat it. It's very important that before you get and you go start buying stuff at the pharmacy and thinking, oh, I have fungus, to show it at least to a doctor. Dermatologist would be better, but not all that looks discolored is fungus. Now, this is again showing a lot of the changes that we see in psoriasis in the same person. So we're seeing the little pits, we're seeing the lifting of the nail. That can be fungus, but it's not fungus. So you see, it's all been lifted here because the person has psoriasis under the nail, in the nail bed, and it lifts up the nail. And it can be very lifted the whole way, like this nail. And then the other thing that is fun to see is something called a splinter hemorrhage. Because psoriasis has extra blood vessels under the skin, they get more easily traumatized, and so they get bleeding spots under the nail. Sometimes they look like lines going down, and that's another thing to watch for that we sometimes see in psoriasis. So the rule is about when we see nail changes in people that is not surgical. We're not talking about the black streak or things that need a biopsy, but of the inflammatory things in the nails. I would say less than half are fungus. Everybody thinks they're fungus, but way less than half are fungus. And even if it's fungus, most of the time it's not treatable because the underlying nail is damaged. So we can't bring the nail back to being normal again. And so the fungus is just going to live there. We're just sort of keeping it under control. Okay, so this is the last picture of psoriasis. I think I spoke a lot about it. And the point about nail psoriasis is very often it's associated with arthritis. So all these red dots, they're still here to remind us that when we look at psoriasis and if they have pain in their joints, there is such a thing as psoriatic arthritis, or arthritis related to psoriasis, and it's very often related to the nails. So if you see nails, always ask them if they have pain in the joints, or if they have pain in the joints, we often check their nails. It goes both ways. Now we're changing subjects. It's another inflammatory condition of nails, something called lichen planus. And lichen planus has a different pathology. It works differently, and it basically affects directly the root of the nail. So what happens here is that the root of the nail is very inflamed, and so you see that the nail plate is now all of a sudden, the nail itself is now all of a sudden growing very weirdly. There's an area here where there's actually no nail. It's like this is skin. This is regular skin, but there's no more nail there. Okay, here the nail is growing in different directions. It's a very variable thickness. You get even here, you get an idea that you got a scar, and this is a very different process that is destructive at the root of the nail. Now, this for me is savable. So if I see somebody like that, it's somebody that I want to see very fast. And basically, what we do is we literally inject them at the root of the nail with cortisone to try to stop this process. So they're coming in and they're saying, "Oh, I think I have fungus and I developed this or whatever." But the process itself is very different. We have to really look at it, understand it, and try to stop the scarring process in the nails, because they if we're lucky that we do it early, we might be able to save them, but otherwise the nails got destroyed by the skin condition. Same thing here. You see that the process is quite destructive, and you're seeing here there's like an extra nail growing on top of the pre-existing nail. The nails are all ridged and irregular in thickness and elevation, and we really try to save it as much as possible. But when I'm saying the money, the action is actually taking place at the root of the nail, way proximal. So this is where you need to treat. You need to treat it, and it's very deep. So very often we can't use a cream. We're going to end up doing injections. But this is very important in the sense that if they damage their nails and the nails are damaged permanently, it has a big importance, not only functionally because they can't grab, but also aesthetically and psychologically, in the sense that they walk around hiding their fingers all the time. Now we're going back to looking at the pigmented spot on the nail, and you can see when we look at the bottom right side here, it's basically, you can see that this thing is growing. That 4 months ago, when we were here at the tip of the nail, there was no pigment, and all of a sudden we have a thick area. So this process, whatever it is, it's very small, but this process is enlarging. The same thing here. Okay, it's somewhat more active at the bottom and less active at the tip. So these are reasons to biopsy. And thirdly, here, this is clearly a melanoma. This is something where there's a cancer of the skin that arose in the root of the nail and damaged the whole root of the nail. So this is something that we need to do a biopsy to confirm it. But then very often what they end up doing is they end up taking the whole nail, and even more sometimes, even taking it down to the first joint, because they want to make sure that they got everything out. So not everything in the nails is fungus. There's a lot of stuff that we do. Part of my many jobs that I have in my life is my clinic at the hospital in McGill at the Montreal General is that I do the nail surgery. Why do I do the nail surgery? Is because I'm not squeamish. I'm not. I don't worry about nails. Most people would faint if they had to do surgery on nails. I don't feel that way. So I can do the surgery and people are not, and I don't faint. Okay, last couple of things. There's many other things that we learned from nails. So the shape of the nail is very important. This is something called clubbing, where, sorry, where the root of the nail here becomes spongy, and the shape, again, follows the shape of the bone around it. Because this area here is very spongy, the nail is now growing into the tip of the finger. And this is usually a sign of disease internally, most commonly of the lungs. So if you see it's rare that I see it, but we do see this as things that have people that have been very sick with lung diseases over many years tend to get this sort of thing. There's a whole list of reasons why this happens, and there's people that are born like that too. So not everybody is sick with this, but the nails, it's worthwhile looking at nails because they're really a good signal for internal health. For example, all the rheumatologic diseases like arthritis or lupus or other conditions like that very often have changes at the level of the cuticle, and you can see different abnormal blood vessels, and that's another way to recognize stuff. So it's something that is part of our skin exam always, is that we look at nails as part of the general health exam of the patient. Again, this straight line. So this is straight, it's very even, it's the same thickness all the time. And people can get moles or can get freckles in the root of the nail. This is probably something that I would not think it's a melanoma. I would not even biopsy it. Now, so that was a very short, very limited discussion of all the changes we see in the nails. So, I want to basically take a few minutes now to talk about just taking care of normal nails. It's important now. Nails are a wonder of nature in the sense that they are growing continuously. It's like having your hair grow all the time, like a poodle. They never shed. The nails never shed, and they are growing for 120 years. And they're growing at the same thickness. The left part of the nail is growing the same speed as the right part. Otherwise, they'd be like a shift or a ridge in the middle of something. And it is really amazing that you don't want to traumatize the root of the nail. So the idea with the nails is we want to cut them not too long or not too short. It sounds funny, but too long, they tend to get traumatized because they tend to get caught up with grab stuff with the tip of the nails. And if they're too short, we are damaging that edge that I showed you about, that is the protection, that is the barrier from stuff getting in underneath the nail. If we can convince you, we want you to cut the nail straight across, not a nice curvature like you see in cosmetic nails. And please ask, or don't do any manipulation yourself, but even when you're going to the manicurist, please ask not to clean too hard at the tip of the nail and not to push the cuticle too far. Now, I'm obsessed with footwear as far as having good nails. And the message is a lot of the damage that we see in women is because they've been wearing shoes that are too tight, and they literally dissolve the bone over many years. They're able to resorb the last digits bones. And remember, the nail follows the shape of the bone, and so the nails become abnormal. So they become overly curved. They become something called a pincer nail, where it looks like tweezers. They're so squashed they can look like basically abnormal because of that. And so we want you, if you can, if we can convince you to wear flat white shoes in front. And then the most important thing, this is my next pet peeve, is to please tie your shoelaces tight. So when we're tying our shoelaces tight, the foot doesn't move forward in the shoe when we're walking, when we're jumping, when we're climbing. And so the toes are always protected and they have room to expand. Like when we walk forward, the foot actually it acts as a spring, and it actually enlarges a little bit, and that gives us the bounce for the next step. And if the shoes are very tight, or if the toes are very forward in the shoe, like because the laces are not done, then every time you take a step forward, you're actually damaging the tip of the nail. So please buy shoes that are well fitting, not overly large, but do the laces tight, so that especially for things like tennis, for hiking, for walking, I don't see anybody in my practice when I tell them take off your shoes. Nobody's doing their laces anymore. Please do your laces, okay? Make them tight. This is a picture of a nail fungus, but even the nail fungus will get traumatized. So try and cut the nails as much as possible. They're here. They're showing we're taking a piece of it to have the fungus. We're trying to isolate the fungus, but basically try and keep the nail short and straight. So everybody comes in, and the minute they have an abnormal nail, they all think that they have nail fungus. And this is something that has been so ingrained in us because there's so much advertising, even on Canadian media, but American media, they're allowed to mention the drug names and the products and whatever. And so people are, they're telling you, oh, you can die of nail fungus. It's contagious. It's progressive. And the truth of it is, there's a little bit of truth and a lot of exaggeration in the process. So don't be overly nervous about this. And remember, most of the time, it happened because we traumatized the nails over many years by poor footwear, and then the fungus got in. So it doesn't mean that if we treat the fungus, doesn't mean that we'll go back to normal nails again. Now, the last part I'm going to talk about is basically nails are very boring. They grow anyway. Okay, so it's not like here we worry about specific dietary deficits like iron deficiency or thyroid problems. Nails tend to be very, very boring. They're growing all the time. They might grow a little bit slower if you have a thyroid problem, but they're still growing. Nobody seems to care. The same thing with iron deficiency. They don't tend to cause problems. I've seen situations where people mention that both for hair and for nails, supplementing with zinc. These are things that you can buy over the counter, like where they sell the minerals and vitamins. Zinc and biotin is a B vitamin that actually might help to make the nails stronger. So when if you tell me my nails are fragile, they're chipping, I can't grab stuff anymore, they tend to fold. This may be worthwhile to add for sure biotin and perhaps even the zinc supplements. Otherwise, as I said, it's very boring. They're growing all the time, and they never get a break. So we have to appreciate our nails more. that's all I had to say for. I hope it's enough. Yeah, I spoke enough. But I'm open to questions if you have any questions that where I wasn't clear, or if you have things that you want to ask me. So I'm going to stop sharing the screen and we give it back to you. Whoever has a question, please unmute and ask me a question.
Hello,
Either
Eli.
you. Oh, go ahead, yes.
Can you hear me?
Yes.
I have
Yes,
a
go ahead.
question.
Yes.
Yes, I have a question regarding aesthetic. I'd like to know if shellac is healthy.
If shellac is?
Healthy. When we put this kind of product on your nail, you know, to have the nail polish stay longer for 1 month, let's say, that doesn't come off easy. So
She's asking, is it healthy or not? Is it an unhealthy practice?
Okay, so thank you. So I'm going to repeat the question just in case. Basically, and I'm going to generalize it in general about the health or the danger of all the nail products that are applied. Okay, so you asked specifically about shellac. The amount of products that are used there is tremendous in the sense that we're using acrylic products, we're using nail hardeners, nail polish, products around the nails, and they all have potential problems. So, for example, let's start with nail hardener. Nail hardener is generally done with a chemical called formaldehyde, which in itself is not bad. It tends to cross-link the nail plate keratin better. So what happens is that the nail gets harder. The problem with it is that it stays on the nail forever. People get allergic from this. So we can get allergic to products. The same thing with acrylics. So acrylics, the monomer can cause problems. Believe it or not, nail polish, the chance of allergy is there, but very, very little, and it's only for the first 24 hours after you apply it. So nail polish is probably one of the safest things. And shellac itself also is not so bad either, okay, in the sense that we're not seeing many problems with it, okay? The other thing that I really worry about is the manipulation that they play with and the speed that they try to harden the monomers of the acrylic with that ultraviolet light dome that I showed you to put the nails on. People are very worried about skin cancer of the hands because of that. So if people are people that I know at home who go to do their nails every week, then I'm worried that they're going to do this 500 times over 10 years, and that's a significant amount of exposure. So there are potential problems, but nothing very scary.
thank you. Thank you very much.
Can I ask a question, please?
Yeah, sure. Go ahead. Continue.
When you're taking care of your let's say your toenails that may have a fungus, can you transfer the fungus to other parts of your body? Like if you with your nail clippers or with if you don't wash your hands?
So I think this is part of the phobia of fungus. Okay, so generally the short answer is no. Okay, so now they're going to ask me, how did I get it in the first place if I didn't, if it's not contagious? Basically, how do we catch the real fungus? How do we catch the real fungus? Is basically walking with wet feet on a rough floor. Okay, so you catch this in a health club, you catch this around the swimming pool. So dry skin is a very good natural barrier to fungus. Okay, so say for example, I come to visit your pool in the summer and I have fungus at the bottom of my feet. I'm going to walk around the pool. It's moist. My feet are wet from soaking in the pool for half an hour, and I'm going to transfer fungus to the rough ceramic around your pool or to the shower, like in health clubs. And so this is how it's transferred. So dry skin is a very good barrier to transferring fungus. So I don't want you to be overly obsessed with worrying about, oh, I'm going to have to sterilize my nail clippers every time I do it. I definitely wouldn't use used ones from in the nail salon, whatever. I would like to have my own or sterilized set or whatever. Just when you go to the dentist or the doctor or whatever, make sure the instruments are sterile. But using it of your own, I would I'm not worried about. I would use perhaps the infected nail last, but I would not be worried that I'm going to be transferring it elsewhere. It's not a realistic fear. Okay, the same thing with, I don't know, I see Amy and Ellie sitting together. If Ellie had fungus, he doesn't have fungus. But if Amy had, I wouldn't worry that one would give it to the other. Okay, meaning that the chances of you being, having wet feet together in the shower at the same time, and then the floor is rough, it doesn't happen at home. So it's a very far-fetched risk. Okay, so not to worry about it. It's not.
Well, you can't get on other parts of your body. This is strictly nail fungus.
It's
nail fungus.
virtually impossible. Okay, so let's talk about how we get it to other parts of the body. So basically, the home base of fungus is at the bottom of the feet. Okay, this is where they live very happily for many years, and you should look at them. Your feet should not have any scaling at the bottom of the feet. So the ones that have scaling on the feet, either they're scrubbing their skin with these volcanic stones, or they have fungus. Now, how do you transfer it? Is, believe it or not, so people get, for example, jaw itch. They get it in the groin. They get it in the groin by basically pulling their pants up. Okay, so then a little bit of the fungus will be on the inside of your underwear or your pants, and you're pulling it up, and that's an area that's naturally a little bit more moist, a little bit more sensitive, and so people tend to get it in the inside of their thighs. Otherwise, you have to really have a very poor immune system to have it transfer to other parts of the body. So it's very far-fetched. Now, in the nail, if it came from the bottom of the foot, it's because there's a big concentration there, and again, the primary or the thing that makes it happen is you traumatize the nail. Either you're wearing poorly fitting shoes, or you cut them too short, or you did something to let the fungus get in. Otherwise, the nail itself is designed not to accept fungus. Okay, so it's a lot less contagious than we're worrying about. Okay, so hopefully there's another question.
Yes, Dr. Balbul, what are the treatments for nail fungus? There's one that's orally taken and one that's a cream. Which one is better? Because I remember when I had it many years ago, my mother said, don't take the oral one. You're going to have side effects. Don't ruin the inside of your body. Ask the dermatologist to give you a cream. And that's what you did. You gave me a cream and it worked.
Okay, good. So basically, again, I'll repeat the question. What treatments are there that are available for fungus? The most important thing for this is to make sure that you have the right diagnosis, that we're not dealing with one of the other conditions that I showed you that looks like fungus, but is not fungus. So that's one. And if we're convinced of it, we want to say, is the nail normal or not? Is the nail being so damaged by other factors that we're not going to bring it back to normal? But once we are sure that it's fungus and we want to follow a treatment, there are lots of topical treatments that we use, which are things that are prescription, things even over the counter, that are quite effective. And so a lot of the time, most of the time, we tend to use topical, I mean, just locally applied, not taken by mouth. It is extremely rare that I end up giving oral medications. Now, the oral medications, to make sure that they are safe, we give them for very short durations of time, just to start the treatment going, and then we finish the treatment with the creams and liquids and gels. Okay, so sometimes we do use medications by mouth, but often just as a starter. Okay, not to complete the treatment, because they can have effects on the liver or the kidneys, etc. So we, again, I know it's very important to have the nail fungus treated, but we're not going to take chances with somebody's health over a nail. So it's not often that I use the oral medications.
Thank you.
Thank you. I'll thank everybody for being so attentive. Thank you very much, everybody, for being here with me. And if you find something else that you want me to talk about, I'll be happy to give another talk in the future.
Thank you so much, Dr. Balbul. As busy as you are, you volunteer and you offer me to give us your speech and all the instructions and all the information you give us. You offered me, and you made me so happy and proud. It's a big honor for us to have your presentation. And this is the time of your work, of your private clinic, and yet you like to give us, to share with us a little bit of your huge information that you have. And I appreciate very much. In the name of everybody, I thank you so much. And thank you all for.
Thank you very much.
Sorry, Dr. Balbul, I do see there was a question about biotin in the chat from Gloria. Was that answered? Gloria, was your question answered about biotin? No. So Dr. Balbul, there's a question in the chat from Gloria. Biotin only comes in high doses in the form of a pill. The lower doses are in a capsule with gelatin or gummies and are not kosher. Could you recommend a product, a biotin product?
Yeah, but not muted. Basically, Gloria, don't worry. Take the highest dose possible. We're not using it as a vitamin, but as a medication for the nail. Okay, so when they say 10,000 micrograms, it's only 10 milligrams. They just make that they are producing an inflation by changing the units. Okay, so 10,000 micrograms or 2,000 micrograms is only 2 milligrams. So safety, there's no issue with the higher doses. And two, it is a B vitamin, which is a water-soluble vitamin. If you take an excess, you just pee it out. Okay, you're not going to do any damage. So I'm very happy if you take that rather than and if you're taking a higher dose and you took a higher dose to do it, then there's no problem. I would not. I agree with you. I would not take the gummies. There's no reason to take a lower dosage. Like this, don't think of it as a supplement, but as a treatment for the nail, and it's safe completely. Nothing much happens. So you can use it. Okay. Bye, everybody. Thank you very much.
Thank you. That's a great information that you gave us. We learned so much from you. We felt like we are sitting in university and you are our professor. Thank you so much.
It's a pleasure. Think of another subject and I'll be happy to do it. Thank you again. Bye-bye.
Thank you. Thank you very much. Thank you. Thank you all for coming. We have the regular people and we have many new ones. And you are all welcome to join us for next week and the week after. We have still several sessions to continue, and each one is completely different than the other, different topics and different speakers. Next week, we are having Ita Yudin. So please join and we learn a lot from her. She is the Vice President of CIJA, the Center for Israel and Jewish Affairs. She will talk to us about many important things, everyone in his field that we learn and we enjoy being together. So until December 6th, every Wednesday we have a speaker at 10 o'clock. And the same Zoom information as today and before. Now, all our sessions are recorded. We have over 100 viewers already from last week. So please go to our website. I put it in every email. You have our website and you can see everything. Xenia is recording everything, and Francoise Babylon, our office manager, is putting them on YouTube, and Sandra is doing the great job of our posters, And Gigi is doing comment on every session, and Sandra is putting together Gigi's comment and her poster. And they're all
And Ksenia, thank you so much for your continuing support. You're a good friend of Women's Learning Group. We
Thank
really
you. It's
treasure.
my pleasure.
That's right. Ksenia became right away one of us. She's
Yeah.
great job in the recording and being with us. We enjoy seeing Ksenia, and Ksenia is enjoying being with us, watching our programs. So
Great.
And Gladys, thank you
you
for bringing us all together, which is something you know how to do so beautifully.
hello, Evelyn Shaheen. Hello, Eli Hadid.
I have to go. Take care, everybody.
Hello, everybody. It's nice to see the regular people coming and the new ones. So, hello, Jason. You are welcome to join us more than today. Thank you. Happy to see you.
Bye, guys. Bye. I'm gonna disconnect. Bye.
See you next week.